Let's begin looking at the individual bones of the skull. So first is the frontal bone. Where do you find it? On the front. Yes, what's big and red and eats rocks? A big red rock eater. Where do you find a dog with no legs? Right where you left it. So the frontal bone is on the front. Forehead, the roof of the orbits, and the anterior cranial floor is what is formed by the frontal bone. Frontal suture is gone by the age of 6. It's called the metopic suture. So notice on the illustration they don't show a suture going down the middle of the frontal bone. There is one, but by age 6 it's completely disappeared. So sometimes if you find a small skull and you can see a metopic suture, and that means that it may be the skull of someone who died before the age of 6. The supraorbital margin of the frontal sinus. So you know where your eyebrows are? Feel that hard, bony ridge underneath your eyebrow? That's the supraorbital margin. And then inside of your frontal bone is a space called the frontal sinus. Sinus means the hollow space inside of a bone. So the hollow space inside of the frontal bone is the frontal sinus. Now you can't see it on this diagram because they haven't cut the bone open for you. But if we could look inside of the frontal bone, we would see that there is a hollow space right basically above where the two nasal bones are. So in between the orbits, right in the middle there where it says the glabella, you don't have to know that term by the way, but it would be right underneath that you would find the frontal sinus. And it extends over to the sides as well. The supraorbital foramen, so notice there's a hole in the supraorbital margin. That's the supraorbital foramen. Remember, foramen means a hole. This is where a nerve comes in, all right, and also blood vessels. So, you know, a black eye, seen people with a black eye? That's from the accumulation of fluid and blood following a blow to the relatively sharp supraorbital margin, your so-called brow line. So somebody punches you in the face, if they hit up by your supraorbital margin, right through that supraorbital foramen there's a blood vessel coming through, and that can burst open, and then you'll get blood that will flow down. Now because of gravity, where is it going to connect? It's going to collect rather underneath your eye, on the bottom half of your orbit. So when you look at people with black eyes, see the blood, see the purple underneath the eye? You might think that that's where they got hit. No, probably not. Probably what happened was they got hit on the supraorbital margin, a little blood vessel burst open, and then all the blood collected down below and pooled down there, all right? There's a very, very famous black eye. I don't know, you may not know who that is. That's Tiger Woods. This is what happened to me a few years ago. Anytime I go across campus to the big administration building, there are benches and there are all these concrete walls. I do kind of like a parkour thing where I jump from the benches to the walls. And one day I just caught my foot and I went crashing down, split my head open there. You can see. That's Zuzu. She was very upset. So this happened on a break in between classes. So I came back to the building after I did this. And I had blood all over my face, all over my shirt. Everyone was upset. Somebody saw him. They actually dialed 911. And the police came and the fire came. I finally had to tell them I had to sign a piece of paper to make them go away. And then I went back in for my second class. I had blood all over my shirt. It was awesome. But poor Zuzu, she was actually crying. She thought I was injured, and I said, no, it's okay. Zuzu is now a pharmacist, by the way. And there's what happened. Notice in my case, I didn't hit the supraorbital margin. I hit over on the side. And that's why the blood collected in a different place. There were a couple days where I couldn't see anything because all the blood collected in there. Okay, let's look at the parietal and the temporal bones. Parietal, the root word means wall. So the parietal bones form the walls on the side of your head, okay? Sides and the roof of the cranial cavity. The temporal bone, so, you know, sometimes you use the word your temples, you know, kind of like right above your ear. There's a common name, we call that our temple. Well, that's where the temporal bone is. Now, the temporal bone has the zygomatic process that forms part of the zygomatic arch. So look in the upper illustration there. See how there's a ridge of bone that goes from your cheekbone, your zygomatic bone, over and connects to your temporal bone. You can feel that. You think of that as your cheekbone, but you can feel that big prominent ridge. If you run from your ear over to your cheekbone, can you feel that big bony ridge? Yeah, that's actually composed of two parts of two bones. It's composed in part from the zygomatic process of the temporal bone. The temporal bone also holds the external auditory meatus. That's the opening for your ear hole. That's where sound comes in. Remember, meatus means a passageway. So external auditory meatus. It's the passageway on the outside of your head that allows you to hear. See, once again, the name tells you what it really means. Then there's the internal auditory meatus. So if you look at the bottom illustration, that ear hole goes all the way through and comes out inside, all right? That's also where cranial nerves 7 and 8 run. Now, you don't have to know cranial nerves for your first exam, but you will for exam 3 and 4. So cranial nerves are nerves that are in the head, and many of them have to do with sensory functions. Cranial nerve number 7 is the facial nerve. It has to do with the movement of facial muscles. And cranial nerve 8 is the vestibulocochlear nerve. It has to do with hearing. So I'm just previewing this for you now. We don't have to know it for your first exam, but you will have to know it later in the semester. I do that a lot. I show you things before you have to know them, so that by the time you do have to know them, you've already seen them a few times. The mastoid process is that big, knobby, bony thing behind your ear. That's where muscles attach. The styloid process, see that sharp, pointy thing? Stylus means like a pencil or a pen. So a styloid process, it's a little pencil or pen-like structure, and once again that holds muscles. That's where muscles connect. The mandibular fossa, that's where your mandible, your jaw fits in. That forms the temporomandibular joint. And can you see now why it's called the temporomandibular joint? The mandibular fossa is in the temporal bone, and then the mandible is your jaw. So when they form a joint, we call it the temporomandibular joint, the TMJ. We'll talk later, you may know about TMJ syndrome, which is where people get a very painful syndrome caused basically by the irritation of that joint. Okay, looking at the temporal and occipital bones still. In the temporal bone there are two openings, the carotid foramen and the jugular foramen. The carotid foramen is for the carotid artery. That takes most of the blood to your brain. So if we were in class, you would have models, you would have skulls, plastic skulls, and I would be showing you these holes on the plastic skulls. Unfortunately, we can't do that. So look here, you can see, if you look carefully on that diagram where it says carotid foramen and jugular foramen. One thing to keep in mind is the carotid foramen is more anterior and the jugular foramen is more posterior. So that's how to keep them separate. Blood goes into your brain through the carotid foramen, carried by the carotid artery. Blood leaves your brain through the jugular foramen. That's where the jugular vein runs. The jugular foramen is also the passageway for cranial nerves 9, 10, and 11. And we'll know those later on. Cranial nerve number 9, the glossopharyngeal nerve. Cranial nerve number 10, the vagus nerve. And cranial nerve number 11, the spinal accessory nerve. The occipital bone is the bone at the back of your skull. So it has a big giant opening in it that you can see. Look at the diagram. That is foramen magnum. So remember, once again, in Latin, foramen means hole, magnum means big. So what is foramen magnum? It's the big hole. So look, I mean, could there be a better description of it than that? So what goes through the foramen magnum? Yeah, your spinal cord. Pretty important. That's how your spinal cord and your brain communicate with each other. The foramen magnum allows that communication to take place. The occipital condyles, remember condyle means knuckle. So look on the diagram, see the occipital condyles. That's where your spinal column rests, your skull rests on your spinal column. That's where they come together. Your head literally rocks back and forth on the occipital condyles. When you nod your head yes, you're rocking your head on your occipital condyles. The external occipital protuberance, so see there at the bottom, That's a big knobby kind of a thing on the back of your head. Some people have a really prominent one, other people you can hardly feel. Usually in class it's kind of fun. Everybody feels the back of their head and somebody can feel theirs has a good prominent one, and then we all take turns going around and feeling their external occipital protuberance, provided of course that they give permission. And then the nuchal lines. So see, there are 4 nuchal lines. I know that it looks like a CH. It is a CH. You'd think it's ch, but instead it's pronounced like a K. So nuchal lines. Those are places where muscles or ligaments or tendons attach again. All right, it's kind of really, it's muscles, and yeah, it's where muscles attach at the back of your head. For now, let's just say that. The nuchal crest runs from the external occipital protuberance to foramen magnum. So see that ridge? The external occipital protuberance connects to the foramen magnum using the nuchal crest. Okay? Now they don't show that on the diagram, but you can see that ridge. All right? Follow it from foramen magnum to the external occipital protuberance. That vertical ridge is the nuchal crest. And then the hypoglossal canal is a little hole, and unfortunately I don't think they show that on this diagram. If we had the actual models in front of us, I could show it. The hypoglossal canal runs underneath the occipital condyles. So you can actually see it in the picture. See the occipital condyles, and then below them, see how there are little holes there? Those are the hypoglossal canals. There's one on each side. That's where cranial nerve number 12 runs, and cranial nerve number 12 is the hypoglossal nerve. Makes it very easy to remember. The hypoglossal nerve runs through the hypoglossal canal. Let's move on and talk about the sphenoid bone. The sphenoid bone is at the base of the skull. It has the pterygoid processes that hang down, and that's where jaw muscles attach. So see those big things hanging down in the picture? Those are the pterygoid processes. You might notice the root word ptery, don't pronounce the P usually, P-T-E-R-Y, ptery. In Greek that means wing. Like there was a big dinosaur bird called the pterodactyl. Dactyl means finger. Pterodactyl was the bird that had finger wings. You could see the shapes of the fingers that made up the wing. Take a look at a picture of a pterodactyl, you'll see what I'm talking about. So the pterygoid processes hang down. That's where the jaw muscles attach. The sphenoid bone is a weird shaped bone. I say it looks like a demon, like a bat, like a butterfly. I don't know. I like demon. I think it looks very demon-like. So it's a weird shaped bone. We'll look more at it coming up. So right now, for example, the body is a cube-like portion holding the sphenoid sinuses. So in other words, there's a hollow space inside of the sphenoid bone. And again, a hollow space inside of a bone is called a sinus. So you can't see it in the picture because they haven't cracked the bone open to show you. But inside of the center of the sphenoid, so look on the bottom picture where it says body, and then it would be sort of up from there, and inside you would have a hollow space, the sphenoid sinus. Then the greater and lesser wings. So notice there are the 2 big wing-like things on the side and the 2 little wispy, delicate wings. So do you see what I'm saying? The lesser wing are the 2 little wispy, delicate wings, and the greater wings are the big, solid wings, okay? The superior orbital fissure. So the superior orbital fissure means basically a crack. And so look in between the 2 sets of wings. See how there's a space in there? See how there's a crack? That is the superior orbital fissure. There's also an inferior orbital fissure as well. So we name them according to whether they're on the top of the orbit. Remember, the orbit is your eye socket. So the superior orbital fissure is the crack on the top of your eye socket. The inferior orbital fissure is the crack on the bottom of your eye socket. This is where cranial nerve 5 passes through, by the way. And so that's the trigeminal nerve. We'll learn more about that coming up. The pterygoid process, again, you can see them hanging down. That's where jaw muscles attach. Then the foramen ovale and the foramen rotundum. These are for passage of branches of the trigeminal nerve, cranial nerve number 5. So what we'll see is when we study the cranial nerves, we'll see that their trigeminal nerve, cranial nerve 5, is called trigeminal because it has 3 parts. It has the ophthalmic branch, it has the maxillary branch, and it has the mandibular branch. So, a little Rona there. I got the Rona. Not really, I'm just kidding. So the ophthalmic branch passes through the superior orbital fissure. The maxillary branch passes through foramen rotundum. Rotundum means round, the round foramen. And then the mandibular branch passes through foramen ovale. So ovale is oval. There you can see on the top illustration. So there are lots of other openings in the sphenoid bone. By the way, most bones have lots and lots of depressions and openings and processes. You don't have to learn anywhere near all of them. You only have to know the ones that are going to come back and be relevant later. So on the sphenoid bone, I make you learn the superior orbital fissure, the foramen ovale, and the foramen rotundum, because we will see later that's where the 3 branches of the trigeminal nerve pass through. So you can see here in the top diagram, see how there's foramen spinosum? You can learn that if you want to, but I'm not going to make you learn it. I think there's enough already to try to keep track of. I'm only going to make you learn the things that I know are going to show up again later. Looking down on the sphenoid from the top, you can see that dark blue bone there. You can see the lesser and the greater wing, all right? The hypophyseal fossa of the sella turcica holds the pituitary gland. So let's go on to the next one, optic foramen. Well, so let's go back. So the sella turcica, sella means saddle, turcica means Turkish. So the sella turcica literally means the Turkish saddle. So look at the sphenoid bone, that dark blue one there. Can you see how there's a little depression there that looks kind of like where your butt would go if you were sitting in a saddle? And they're like the horns of the saddle, on the front and on the back. So that whole thing, the whole saddle, is the sella turcica, the Turkish saddle. It was named because it looked like the saddles that Turkish soldiers used when they rode. And then the dent, the place where your butt would go, that's the hypophyseal fossa. Okay, fossa again means a depression. That's where your pituitary gland sits. And another name for the pituitary gland is the hypophysis. So that's why it gets that name. It's the hypophyseal fossa because it's the depression where the hypophysis sits. Then you can see the optic foramen. There's 2, one on each side, so they would both be optic foramina. That's where the optic nerve passes through. That's how your eyeball communicates with your brain. The optic nerve runs from the eyeball through the optic foramen to the brain, and that's how you see the world. The optic foramen is where cranial nerve number 2 passes. That is the optic nerve. So I took these illustrations from a medical atlas. Look on the left at the sphenoid bone. There's got to be at least like 50 different parts of the sphenoid bone. And you look at the temporal bone on the right, there's got to be, I don't know, at least 30 or 40 parts of that. I'm not making you learn all these parts. I'm really not. I'm only making you learn the ones that I know we're going to see again later, okay? So, no whining, okay? Alright, the ethmoid bone. The ethmoid bone is a cube-shaped bone that sits deep inside the skull. It's back behind your nose. It's kind of hard to visualize. You can't really see it from the outside. And it has different parts that you can't see all of them from the same view. So you have to keep rotating the ethmoid bone in order to see all the parts. Let's start talking about the ethmoid in general and the various parts. So it forms part of the anterior portion of the cranial floor, the medial wall of the orbits, the superior portion of the nasal septum, and most of the superior side walls of the nasal cavity. Whew. It's a major superior supporting structure of the nasal cavity. It's an important bone. It's a cranial bone. It forms part of the entire integrated complex of bone that your brain sits in and that holds everything together. So it's an important bone. It's just difficult to see from the outside and to see all of it at once. So let's start talking about the parts. First, the crista galli. So notice in the upper left you can see the crista galli there. You can also see it in the middle, crista galli. You can also see it on the right view. So again, trying to show you So in the upper left, we have a, what view would that be? That'd be a coronal view. All right, and then in the middle, we have a sagittal view. So the cristagalli, it's a crest. Crista means crest, and galli, like in Spanish, gallo, the rooster. So cristagalli is the rooster's crest. When they first started naming bones, this reminded them, you know how roosters have that kind of crest, that comb on the top of the head? It reminded them of that, so they called it the rooster's crest. That's where membranes that cover the brain attach, all right? So again, you can see it looks different from different views. So you got to get used to that, all right? I know it's hard. Looking on the right, by the way, let's just spend a moment on those views. Where it says ethmoidal cells, that's just another name for the ethmoidal sinuses. These are hollow spaces inside the ethmoid bone. Then see the cribriform plate? It runs on both sides of the cristagalli. That's where your sense of smell happens. I know it's hard to visualize this. The ethmoid is kind of up near the top of where your nostrils are. And so you have structures called olfactory bulbs that sit in the cribriform plates. And that's where smell information travels to the brain. I got that COVID. Not really, I'm just kidding. All right, so, and then looking again on the right diagram, you can see cristagalli. Notice you can see the ethmoidal cells again on the bottom half on the right. See how it says superior nasal concha and middle nasal concha? I don't make you learn that in Bio 201. We do have to learn it in Bio 202 as part of the respiratory system. But then notice the perpendicular plate hanging down. The perpendicular plate forms the top half of that line that you see when you look in the nose hole of a skull. Let's take a closer look. So now, on the bottom right, see when you look in the nose hole, I'm not going to use any technical name for it, nose hole, good enough, close enough for government work. So that line, you can see, goes from top to bottom. The top half of that line is the perpendicular plate of the ethmoid bone. The bottom half of that line is its own separate bone called the vomer. When those two bones come together, they form the nasal septum. Septum means divider. The nasal septum is what divides your left and right nostrils. So notice, it looks like it's all one thing, but it's actually two bones that come together there, okay? So again, the ethmoid sinuses or ethmoid cells are the hollow spaces. You see good pictures of them on the illustration on the left. All those little spaces in there. The perpendicular plate is the upper half of the nasal septum. The superior middle nasal concha, or turbinates, is another name for them. They filter and warm the air. Again, you don't have to know them for Bio 201. We'll talk about them in Bio 202. Your lungs don't like cold air, so as air comes in, it has to swirl through those conchae, and that causes it to get filtered, filters the nasty stuff out, also warms it and humidifies it. The cribriform plate, again, is where the olfactory bulbs sit. That's where the sense of smell, the information passes from the nose to the brain. And finally, let's take a look at the maxillary bones. So that's the upper jaw, the floor of the orbit, the floor of the nasal cavity. They form the hard palate. So the maxillary sinus, again, you can't see in this illustration, but inside of the maxillary bone there are hollow spaces. Those would be the maxillary sinuses. The alveolar processes are what hold the upper teeth. So look on the illustration, see those ridges above the teeth? Your teeth fit into little depressions called alveolar sockets. Some people say alveolar. Again, I don't care. So, but the ridges are basically the boundaries in between the sockets. Those are the alveolar processes. The infraorbital foramen, look at the word, infraorbital, underneath the orbit. So it's the hole underneath your eye socket. And what do you suppose runs through there? Sure, the infraorbital nerve. Also, blood vessels as well. When we get to the nervous system, we'll be talking about the infraorbital nerve, which passes through the infraorbital foramen. Now, in some cases, the cleft palate is a condition in which the maxillary bones don't completely fuse together. They're originally not connected. They fuse during embryonic development, but sometimes they don't completely fuse and a baby is born with a space in between. That's what's called a cleft palate. It's where the two maxilla didn't fuse. Here you see it right here. Now, if you're lucky to be born in a place that has hospitals and clinics and doctors and surgeons, they'll fix that right away. But I know I've traveled through Central America in some very poor regions, and you'll see people on the streets, with cleft palates. They didn't have a hospital nearby when they were born, and so they have that all the way into their adult life. So normally, though, if there's hospitals and surgeons, they'll get on that right away. Here you can see already they've taken to doing some surgery, fill that in, and you can still see the scar here by the time she's a little girl. You can tell something was there, but as she gets older, that'll become less and less prominent. It's a great thing that we're able to do with medicine, be able to fix people up so that they don't have to go through life like that. It's hard to keep food in your mouth when you're chewing. Okay, I'll see you in the next PowerPoint on the bones of the skull.